So the second phase of the Spark program after strengthening is pain relief. And so unlike strengthening, pain relief modalities and things that you do to achieve relief can be done every day. So remember, strengthening is about every other day. These pain relief strategies, I recommend doing them as much as you need to. So let's review some of the most common pain relief strategies that I use with patients with back pain and leg pain related to lumbar spinal stenosis. One being a traction machine or a traction unit. And so these units can be found at a chiropractor's office or other offices that have the unit. You can buy units online that kind of give you that separation as well. Traction units can vary, and the exact way that you do it varies as well. And so let me give you an example. Some places may recommend that you do it for 5 minutes, but 5 days a week, and other places may recommend 2 or 3 days a week before 15 minutes. And what the research showed is that when you're actually doing traction to the spine and you're trying to pull on both sides to increase the space, because that's what we want to do with stenosis. Stenosis is a space issue, so we want to improve the space. So intuitively, it makes sense that traction would work. But when we're looking at how much space is actually improved when you do traction, it's millimeters, 2 to 3 millimeters. What I have a problem with is that doing lumbar spinal stenosis treatment, and some of that including traction, and doing it, let's say every other day, and giving yourself some relief, but you're not taking advantage of that pain relief. And so what I recommend to my patients is like, try it out and see if it works for you. But if you do complete the traction and improving the space in the spine, the research shows that you need to be doing some exercises after it. So if you do the traction and you're looking at the Spark program, I would be doing the pain relief traction, and then I would be doing the mobility and strengthening. And so you would be doing the strengthening aspect and then regaining spine mobility. When you combine those things, the results are just better and the results last longer. The other aspect is TENS. And so a pain relief strategy that I see patients use and they ask me about is a TENS unit. And so what that TENS unit is just an electrodes to the lower back or in the leg or wherever you're feeling the pain. When you're looking at a TENS unit, it can reduce pain. It can reduce the sensation that you're experiencing from your spinal stenosis. And so what it will do is reduce discomfort, but it has no impact on the actual space of your back or the actual nerve health. It just gives you some pain relief, and that's why you can use it often.